Coming of Age is coming up next. I'm your host, Emily Echeverria. First up today, we're going over all you need to know about your annual Medicare Wellness Visit. Next up, we're checking in with the Memory Disorder Clinic about what resources are available for those dealing with dementia symptoms or diagnosis. Lastly, we'll be learning more about Council on Aging's senior volunteer programs with our very own Alesia Macklin. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. What is an annual Medicare Wellness Visit, and why is it so important? Many seniors may not know the answer to this question. To help us answer this question is Emily Purvis, a Population Health Manager at Baptist Healthcare. Thanks for joining us today, Emily.
Thanks for having me.
So first off, why is the Medicare Annual Wellness Visit so important?
So the main reason why the Medicare Annual Wellness Visit is so important is because it affords the patient the opportunity to create a personalized prevention plan with their provider. This will kind of map out for the rest of the year what the plans are for preventive services as well as mitigating any risk factors that are identified during the visit.
So what is the difference between that annual wellness visit and an annual physical exam?
So the main difference between the Medicare Annual Wellness Visit and a routine physical exam is that the Medicare Annual Wellness Visit is more of a planning session between the patient and the provider. The routine physical exam may include some more comprehensive factors in the visit, such as ordering of laboratory tests or medication management and things like that. But the annual Medicare Wellness Visit will allow for the patient and their primary care provider to make a game plan for the upcoming year, essentially.
Gotcha. And who can perform that Medicare Annual Wellness Visit?
Sure. Any provider that is participating with Medicare can perform the visit, such as physicians, nurse practitioners, physician assistants, but there are other healthcare professionals such as registered dietitians or nutrition professionals that can also perform the visit.
Gotcha. And how long does it take to complete that wellness visit?
Generally, it takes approximately 20 to 45 minutes, depending on the level of questioning that the provider needs to take place with the patient. You will have questionnaires to answer prior to the visit, and then the provider uses that information to help figure out what are the best ways to counsel you on those risk factors.
So you said this is kind of a planning visit. What sorts of things are they planning for the year?
So most importantly, we're going to create a personalized prevention plan. So prevention is key with the annual wellness visit, meaning any preventive services such as a screening colonoscopy or a screening mammogram, and down to even some laboratory work that is considered preventive in nature. Sorry, I forgot what you asked me.
Just what they're planning for the year, what sort of things that they go over.
So the personalized prevention plan is the big key, but then they're also going to look at your health factors and risk factors that are associated with those health conditions to help you mitigate how to stay healthy versus treating you when something has gone wrong or a disease process has moved on.
Sure.
Progression.
So really looking at what the risk factors might be, what sorts of things you might need to keep an eye on, and what they can do to prevent anything from worsening or arising.
Correct. Yes, exactly.
Gotcha. Okay. Are there any costs associated with the annual Medicare Wellness Visit?
No. So Medicare has deemed this a zero cost sharing type of visit. Now, having said that, there may be some times where your provider does have to perhaps change some medication based on the conversation that you're having, or order some additional tests. So when that happens, there could be cost sharing like co-pays that are involved. But for this visit, it is no cost to the patient.
Great. Okay. How do you prepare for your annual Medicare Wellness Visit?
Sure. Really, the best way to prepare for your annual wellness visit is to gather as much information as possible for your provider. Typically, this visit is performed by your primary care provider, and so there is a level of understanding already based on the relationship that you have with that provider. But if there are any additional information that can be brought to the provider during this visit, that's kind of what we're looking for. So, for instance, I'm thinking family history, if anything has changed or there's new information, any of the medications that you take or are on currently, we would want to make sure that we have a full complete list of those medications. And then another important factor to prepare is to gather all of your other providers so that your primary care provider knows exactly who you're going to for your specialty care, and or if you receive equipment from a supplier of some sort. That's important for the PCP to understand so that they can help coordinate your care.
Okay. So any updates in health status, family history, medications, and any kind of equipment or specialist that you utilize as well.
Yeah, and another important thing is, although your primary care provider, depending on how long you've had the relationship with them, they may know of your preventive services, but any additional information that you have, so say you have a primary care provider with Baptist, but you had a screening colonoscopy at Sacred Heart, you would want to bring that information with you as well so the PCP can update their records for you.
Gotcha. Well, thank you so much for sharing this information with us today, and we'll see you soon.
Thank you.
Coming up, we're talking about dementia evaluation and resources. Stay tuned.
It's important to get a flu shot each and every year because flu viruses are constantly changing and immunity from the vaccine decreases over time. Flu vaccines are updated annually to work against that year's viruses. The best time to get your shot is in the fall, but getting it later can still help. Getting a flu shot lowers your risk of getting sick, and if you do happen to get flu, it's likely to be less severe.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram or go to aaflorida.org/volunteer.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
For many seniors and caregivers, dementia or diminishing cognitive functioning is a looming concern. For older adults dealing with memory loss or similar symptoms, asking for help may be a challenge, and for caregivers, changes in personality and brain function of a loved one can lead to conflict and pain. Leslie Provis from the Memory Disorder Clinic is here to talk to us about this issue and how to approach diagnosis and care planning for this complicated topic. Thank you for being with us here today,
Thank you
Leslie.
so much for asking me. Glad to be here.
First, can you tell us a little bit about the Memory Disorder Clinic and your role there?
Sure. Memory Disorder Clinic is with the medical center clinic that's next to West Florida Hospital. And so we serve those with memory loss, cognitive deficits. And they're typically 65 and older. And my role, which I love doing, I don't like saying I'm going to work, is I'm the social worker there. So I get to work with caregivers and family members providing education and just more about the diagnosis and what to expect.
So what does that evaluation process look like when someone's coming in for that initial assessment?
So I get to ask them questions about their education. How did they do in school? Do they need tutors? Did they repeat grades? Because we want to see how they did intellectually. Background as far as have they had a stroke? Have they had a TBI, a seizure? Try to rule out the physical aspects of it. Do they have any problems with psychiatric illness, substance abuse? So we ask about family history. Has anyone had dementia, Parkinson's, ALS, as well as substance abuse and psychiatric history? And then I do a short little quiz with them. And then depending upon how they do on the quiz, will determine the next type of psychological testing that they do. And then I get to work with Dr. Ethan Gore. He goes in and he does his physical assessment. We'll ask some additional information. And then typically orders an MRI, EEG, your standard lab work, and then additional neuropsych testing. The MRI is going to show if there's any shrinkage in the brain, any abnormalities, any bleeds, any strokes, and the EEG is going to show the processing speed, if there's any seizure-like activity. And then the lab work, which is basic, is going to look at your potassium levels, your anemia, B12, and just kind of rule out if there are some other issues aside from memory loss.
Right. And I understand there's a lot of just ruling out of kind of other things that might be affecting cognitive function to see if it's one of these types of dementia or Alzheimer's. Mm-hmm. So what are other resources or support that the Memory Disorder Clinic offers?
The other thing I get to do is education and planning visits. In education, I get to talk about symptoms of delirium, like when people are seeing or hearing things that can be caused by infections, broken bones, any type of major trauma. I get to talk about power of attorney, advance directive, and the resources that are out in the community as far as home health options, assisted living communities, how to plan ahead. And a lot of caregivers will give me a call and they have additional questions. And I have some that are like, I don't mean to bother you. And it's like, you're not bothering me. I really appreciate when you call, because if you don't ask these questions, I don't know how to help. And I link them up with community resources. And we've got a lot of great resources out there. And I continue to learn who's out there, the services that they provide. It's pretty cool. We have a great network of people.
Yeah, we do. It's awesome. What are some of the early signs and symptoms that people or caregivers can look out for that might indicate a change in memory function?
There are normal aging issues. We may forget where we put our keys, misplace things, maybe we forget what the date is. But for those that are struggling with memory loss, they're forgetting more. They may have word finding issues. They can't carry on a conversation. They might get confused when they're driving. Anything that's going to affect activities of daily living. Same thing with financial situation. We may miss a monthly payment, but those that have memory loss, they continue to have problems with financial situations.
Mm-hmm. So when it's really starting to affect that day-to-day life, it's not kind of this minor irritation. I understand that individuals who are getting symptoms of dementia, they might be in denial about the situation. Mm-hmm. So what advice would you give to caregivers or family members on how to approach the topic?
Good question. I was reading more about that the other day, and I encourage caregivers to recognize that they're having issues accepting the diagnosis. They may recognize that they are having memory loss issues, but no one wants to really accept that that is a problem because there is no cure. There's no way to prevent it. And so being kind, being loving, being patient with them and accepting what they're going through and just extremely supportive with them.
And lastly, quickly, what are some other tips or resources you'd suggest for caregivers of those with dementia?
Definitely support groups. And we have some great support groups out there because it reminds them that they're not alone and we all learn from one another. So seeing how someone deals with a certain situation with their loved one is going to help someone else. So support groups are great. And there are also, for those patients, the adult daycare treatment centers like that's at the Council of Aging, which is the retreat. Mm-hmm. And I refer a lot of people over there, and the ones that have been there, they love it.
Awesome. Well, we love to hear that. Anything else you want to add about the Memory Disorder Clinic and what you offer?
Just that it's a great place. We have really good staff there, and I have fun working with the patients and caregivers. I mean, they're, living with a terminal illness, and it affects not only the patient, but everyone that comes into contact that live with this patient. And it's a continual learning process. It's not easy at all. So I'm really grateful and blessed to be working there.
Well, we're so glad that you're over there and that we get to work with you so often.
Yes, ma'am.
Well, thank you so much.
Thank you.
Stay tuned. We're talking about Council on Aging's Senior Volunteer Program next.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
¿Qué color? Perfecto, amigo.
Gracias. Thank you.
What's wrong, amigo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
For active older adults, staying engaged in the community is one of the keys to maintaining health and wellness as we age. Volunteers with Council on Aging Senior Companion and Foster Grandparents programs also get to share their skills, knowledge, and friendship in these roles. Here to tell us more about these programs is our own Alesia Macklin, Director of Senior Volunteer Programs. Thank you so much for being with us here today, Alesia.
Thank you so much for having me. It's always great to be back.
It's my pleasure.
Thank you, ma'am.
First of all, tell me a bit about your role as the director of our senior volunteer programs.
Well, I am at an amazing agency, Council on Aging, which does so much for our community. We are serving persons who are 60 and over. I am part of what is called AmeriCorps Seniors. A lot of people know AmeriCorps because of Meals on Wheels. So AmeriCorps Seniors is the 55 and over side. So people who are vibrant, lively, want to give back to their communities. I'm the director of that program with two wonderful staff members, Velma Franklin, who is the coordinator for our foster grandparents, and Tyler Osborne, who's the coordinator for our senior companions.
And speaking of senior companions, let's start with that program. Tell me about what that is and who's involved with that.
Oh, wow. As I said, those persons who are 55 and over, still vibrant, still lively, want to get back to their communities, but they have a heart for persons who are closer to their age. So they're all 60 and they're all 55 and over, serving persons who are 60 and over. So if there's an individual in their homes, just kind of socially isolated, needing more nutrition, kind of not feeling like they're loved or feeling like, man, they want to do anything anymore. Senior companions can come into that home. They can help that person see that they have a purpose. They have a life. There are many, many more things that you can do. Let's get out. Let's go fishing. Let's go to a senior dining site, which we have those at Council on Aging. So here are some activities that you can do there. They motivate those persons to get out of that house, or if they're not very mobile, while they're in that home, providing that companionship for them. That's one aspect. The other is you may be a caregiver. You may be that person who is providing for your mom, your dad, your grandparent, your neighbor, and you need a break. That senior companion is there for you to be able to go to work, feel comfortable that your loved one is being cared for while you're gone. Also, to feel comfortable that someone there is with them who's going to be a safe person for you. And to make sure that you're getting a break and you're getting away from it all so that you can feel revived when you have to come back and be a caregiver again.
Absolutely. That respite is so important for caregivers.
Yes.
So let's change gears to foster grandparents.
Yes.
So that's a bit of a misnomer, right?
It is.
Tell me the details of that program.
Because it has absolutely nothing to do with the foster care system. Those are persons who are also 55 and over, way more vibrant and lively. They have a heart for children. So they're in daycares, Head Starts, public schools. Both programs, I want to make sure I say, they can serve persons who are developmentally challenged as well. So we have foster grandparents who are at Capstone Adaptive Learning, who are at Westgate. They serve those persons who have a little bit more of care needs while they're learning. So they are with those kids, making sure that they understand you can do it. You can make it. No matter what's going on in your life, I'm here for you, and I'm going to give you that love and that nurturing while I'm letting you know that 1 + 1 is 2, and blue is green, and green is blue. So, they are having a great time doing that.
I know that we love the grannies from my child's child development center that she used to go to. So there was a granny in every room and she loved all of them.
Thank you. Wish we had 1,000.
What is the impact that program has on the students?
Oh, wow. You have some children who come from some serious challenges in their homes. A lot of them may not be eating every day. A lot of them may have a lot of trauma going on in the home when they leave school. So coming back to school and engaging hard. So grandparents are there, foster grannies, grandpas, letting those kids know, hey, this is an environment, it's safe, you can calm down and you can learn and you can grow here with me.
Mm-hmm. Giving them that little extra
amazing. Love. The kids can read more. They're doing better on their tests. They're staying in school, which is just so phenomenal right there. So it is insane what it does for that child and for their families as well.
And how about for the teachers? I'm sure it's a big boost for them as well, and they need all the help they can get.
We have principals who will call Velma, their coordinator, and say, hey, where's Granny today? And we have to remind them, they have a life too. So they have some things they want to do sometimes. But those teachers are just like, wow, having that person in my classroom, having that extra eye on the kids, or having that extra person who can take the ones who have a little need for a little bit more help, taking them to the side and working with them in that classroom. Oh, the teachers are absolutely, and the teachers like to get that hug and that love too from the foster grandparents. So yeah, they love their FGPs.
Awesome. So what do you have coming up that the community can get involved in with your senior volunteer programs?
We would love it. We are funded by AmeriCorps seniors, but everybody would love to give a little bit more. And they do have some needs, getting more uniforms, things such as that. I would love to have some restaurants start providing a meal for them once a month when they're doing their in-service trainings that they're required to do every month. But we have a fundraiser coming up called Granny Get Down, and they're not going to be shimmying across the floor, but they are going to be cooking up and baking. And those persons of a certain age can cook and bake phenomenal dishes. So it's going to be March the 9th, 2024. at Bayview Senior Resource Center from 11 to 1. We want everyone to come on out. We're going to be dancing, having a lot of great music, and we're going to have a lot of great food that they can go around and taste for only $10. Where can you do that?
So you can buy your ticket $10.
Yes.
And where can you buy the tickets?
Council on Aging, come right to our office. We're looking forward to having it online for them to be able to press a button and be able to get those tickets online as well. But right there, Council on Aging, just give us a call, $10, eat all you want.
All right. And that'll be a really fun day at the Bayview Senior Center.
Ma'am.
We're really looking forward to it. So what would you say is kind of the biggest takeaway of the senior volunteers who serve in these roles that you hear from them, what they get out of these programs?
A lot of them say it changed their lives. A lot of them say they wouldn't have the life that they have right now if it would not have been for this program. We have a foster grandparent that has told us it has literally been the reason why she gets up in the morning. A senior companion that says, I never knew I could give back like this and feel this kind of love from someone who needed me every day. So for them, their health improves, their outlook improves. They're not sitting at home watching Judge Judy and Steve Harvey all day. So they're really, really feeling engaged and they feel like they have a purpose.
That is awesome. And that is what we hear so much from these volunteers when I talk to them. Thank you so much for joining me today,
Thank
Alesia.
you, Emily. You are awesome.
You are awesome, Alesia.
Thank you.
Thank you. And thank you for watching. Until next time, enjoy life. You've earned it. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you.